Hi, welcome to our Project 31 YouTube channel. We're so glad you're here. I'm Jane Wilson, CFO for Project 31. This is Jennifer Harrod, our nurse navigator. Jennifer, what wealth of information do you have for us today?
All
Got some
right.
good stuff, right?
Oh, yeah. Always.
Always. When Jennifer comes with paper in hand, we're going to learn something.
Oh, yeah. And my paper is in hand
I know,
today,
I see it.
so
I
I'm
love
ready.
it. I love it.
Today we're going to talk about what can we do to help decrease our risk for breast cancer. And these are both modifiable and non-modifiable, meaning some we just have no control over. So some are modifiable, meaning we can change things, some things. Non-modifiable, we can't change the fact that we're women or that our DNA is certain
Or if
way.
you're BRCA positive or those kinds of things.
Exactly. So those are the differences between modifiable and non-modifiable. So we'll start with non-modifiable risks. Genetics.
Yep.
Number one. Can't change that. Age. We are the age we are, and most breast cancers occur after age 45.
Right.
Most, although it seems like it's getting younger and younger every day.
Yes.
Also, another non-modifiable risk is personal history. So if a woman has a personal history of breast cancer, she's at a 1.5 time higher risk of developing a new breast cancer. So that's non-modifiable. Family history. Women with a family history of breast cancer have an increased risk to have breast cancer, even if it's not genetic.
I know. And the way that's been explained to me is they just probably haven't found the gene yet.
Exactly.
Like it probably is genetic, we just don't know.
We just don't know,
Gene.
but they're coming up with more and more of it. Even since my diagnosis 5 years ago, I'm curious to know, have they found any new genetic links to my breast cancer because of my family history. But breast changes. So we all know that dense breast tissue or a history of ductal or lobular hyperplasia also can increase your risk, and those are non-modifiable. And you often hear, you have dense breast tissue. I know I did.
Well, when you're young, that's
Yeah.
very common.
Exactly, exactly. So another one is early menstruation,
And early would be considered what age?
before age 12.
Okay. So yeah, definitely there are girls
Yeah.
getting their periods at 10,
Yeah,
11.
there are. And later menopause, so after age 55.
Okay.
So also later first pregnancy, age 30 or later.
Okay.
And women that were never able to have children. So, and really the reason that this is so, because you often hear that, but you don't really know why, it's because your body has longer exposure to the ovarian hormones, especially estrogen.
That makes sense. So because a lot of breast cancers are estrogen fed.
Yes,
Okay.
a good majority of them,
Yeah.
especially after age 45.
Yeah.
So if you started
just
your
had-
cycle earlier than 12, if you
Yeah.
went through menopause later than 45, you've had
You've had a lot of estrogen coursing
Yeah.
through your body.
exactly.
That makes sense.
So, and those are changes not like we
Can't
can
fix
do
that.
anything about
Yeah.
that. Yeah, I mean, also prior radiation exposure, meaning, don't panic and think it's just x-rays, but women who have received radiation therapy to the chest, neck, and axilla area, such as women who have received treatment for Hodgkin's lymphoma before the age of 30,
Okay.
because they've had that radiation exposure. So those are really the common non-modifiable risks that we're
Okay.
going to talk about. So,
All right. So there's not much you can do about those. Just be aware that puts you at a little bit higher risk.
Yeah.
Okay.
Be aware, start talking to your doctor about your risks early.
Make sure you're getting mammograms. Make sure you're getting exams
Exactly.
and all that.
And if you have this non-modifiable risk, start talking to your doctor, at age 20, 25 about, hey, there's some things I want to talk to you about. What should I look at for my screening for myself to be on the lookout?
Right.
So,
Okay.
but what can a woman do to reduce her risk of getting cancer? Now, I want to preface this with saying if you have breast cancer, you did not cause your breast cancer.
Yeah.
Some women myself included, what could I have done to stop myself from getting breast cancer? Well, these are modifiable risks, but sometimes if we're going to get it, we're going to get it.
Right.
So don't beat yourself up.
Right.
Weight control, though, is one they're looking at as really being a bigger risk. Consuming a low-fat diet and maintaining a body mass index which is within the normal range for one's age group is very important. Postmenopausal women with a BMI of 31.1 or higher have a 2.5 times greater risk of developing breast cancer than those in the normal range. Having more fat tissue can increase your estrogen levels in the body and therefore increase one's risk for breast cancer. So there has been a study, a meta-analysis of women who did not use hormone replacement therapy, and in this study it suggested that for each 11 pounds that a woman gains as an adult, the risk of breast cancer in her postmenopausal years increased by 11%.
Wow.
So
11 pounds is not a lot of weight.
It's not.
I mean, it really isn't. You can easily gain 11 pounds.
Oh, I
in
have.
Just, sadly, a short amount of time. Right?
Yes.
It take a really long time to lose it, but you can gain it real quickly.
I'm good at that.
I got the gaining part down. I'm good at that too.
No, the losing part, not so good.
Yeah. But that's not a lot of weight. It's not like saying being 50 pounds overweight is the cause, right?
Yeah, it's a small amount of weight.
It is.
So, I know it's hard for me. I try to watch my diet, but, it's hard, especially as we get older.
Right.
Oh, goodness.
Right? It's so true.
Yeah.
But doable.
It is doable.
It's doable. It is within your control.
It is.
Okay. Modifiable.
Modifiable, regular exercise.
Again, within your control.
At least 150 minutes a week of moderate aerobic activity.
Okay. And that can include walking.
Yes, walking's great.
Yes. That doesn't mean you have to go to jazzercise.
No. And that may not even be possible for a lot of women. I mean,
Right.
just getting up and walking and
Right.
moving, walk your dog,
And it doesn't have to be all at once.
No, you can break it up.
Doesn't have to be an hour a day.
30 minutes a day. I mean,
And it doesn't have to be 30 solid minutes.
no,
It can be 10 minutes in the morning, 10 minutes at lunch,
exactly.
10 minutes at dinner.
Taking the stairs at lunch if you can, or just
Right.
walking around your office if you can.
Whenever I worked at a really large church one time for many, many years, and we mapped a route inside on the days that it was too
that's
hot or
great.
too cold to be outside. And we would just, lap the building over and over again at lunchtime, just trying to get a little bit of activity in our
It's a
day.
great idea. And that's,
You can do it if you want. I mean, even if you don't want to, you can do it. I never want to, but I always need to, and so I do.
Exactly. So another modifiable risk is alcohol intake. There are more and more studies. It used to be just, we're not really sure about how this affects
And
breast
do we
cancer.
think that's the sugar?
So, I'll get into that.
Okay,
That's
good. Because I wonder if that.
Yeah,
I'd be interested to hear.
and there's been different
me more.
studies throughout the years, but there's more and more studies recently to avoid or limit alcohol intake. Alcohol consumption increases the risk for breast cancer by around 7 to 10% for each drink of alcohol consumed on a regular basis daily.
Okay.
So that's daily on a regular basis, not just
So if you have one drink a day, most days of your life, you've
Then
increased
that's-
it, whatever that percentage
right.
is.
But, a lot of us on occasion, we will have a glass of wine for a celebration, for a dinner. So that's not talking about that.
Right.
But the reason alcohol can increase the risk is because alcohol has been associated with higher levels of estrogen.
Interesting.
Yeah. So I found that one interesting. I know they've been trying to correlate that more so. and
Where is
there's-
it coming from? Yeah.
And there's still more studies
Sure,
going, so
sure.
sure we'll know more, but just avoid or limit your alcohol intake.
Right.
So,
Yeah, just moderate.
right. Use of hormone replacement therapies, especially those that are estrogen based. They increase your risk of breast cancer, and women currently using or recently using hormone replacement therapy for 5 years or longer have an increased risk.
Okay.
Okay. So I know for myself, I had a hysterectomy at 38 years old, and I was taking an oral hormone replacement estrogen.
Yeah.
So,
Because you were 38.
yeah. And, I'd gone through menopause, surgical menopause. And so I started taking that. Well, my breast cancer was hormone negative, but still, you wonder. And then after you go through breast cancer treatment, I hear all the time, even myself, especially myself, talk about, oh goodness, I wish I could take some kind of hormone replacement. But there is a risk for doing so.
There is. And, even like you, even though my cancer was estrogen negative, my doctor said, I still don't want to put you on estrogen. He said, he goes, if you can tough out the hot flashes, and he gave me some other stuff to kind of help with that, but he said, if you can kind of tough it out and get through it, he goes, ultimately, I think it will lower your risk to not be on estrogen. And I was 40, so I mean, I had a long time to be in menopause. I've been in menopause a long, long time. I've been in menopause probably longer than I had periods at this point in my life. But he said, even though you were estrogen negative, he's like, I just don't feel good about it. I don't want to put you on it unless you just insist. And I said, I don't insist. So
I fought hard.
well, I just trusted him,
Yeah.
so. And I always wanted to do anything I could to lower my risk.
Yes, definitely. So women that have used hormone contraceptives that contain both estrogen and progesterone can slightly increase the risk for breast cancer, especially if they have used the contraceptives for 10 years or more.
Yeah, and that was me.
And the risk does go down once you're off of those contraceptives. So, you can always get off of them if you can. So.
Yes.
Breastfeeding. Also, if possible, some women it's just not possible.
Right.
Breastfeeding your babies can decrease your risk of breast cancer. So, I fell into one of those where I could not have babies. I could not get pregnant, just was never able to. So that increased my risk, and then I couldn't breastfeed
anybody either.
So, life throws us curveballs and we deal with it. But those are some modifiable and non-modifiable risks just to help you.
Well, and certainly the diet, exercise, and the alcohol are the easiest ones, right? Those are just, we need to be doing those for so many other reasons anyway, not just breast cancer. It helps you with managing diabetes and some other
health.
Cardiac, so many things. So those should be, those are non-negotiable, honestly, that you need to incorporate that into your life. You'll just feel better, honestly, too. Just feel better by moving your body and eating a little less. I mean, listen, I'm working on it. Jeez, it's hard. It's hard, but it's doable. It's doable, right?
It is.
And I think anytime we can do something to kind of lower our risk, you go, yes, I'm going toward the right path. I'm lowering my risk. That doesn't mean it's not going to come back. And if it does come back, these things will help you anyway. It would help you if you did get cancer again to weigh less. It would help you if you did get cancer again to be more mobile, right?
Right.
It's all going to be beneficial from that point of view. So I like all those modifiable ones.
Yeah.
The non-modifiable, we can't do much. Just be aware, right?
Yeah, exactly. Just start monitoring.
Exactly. And if you do have a family history of breast cancer and you do have an opportunity to get genetically tested, and if you have daughters and or sons, honestly, especially what my daughter's doctor told her, because my husband had prostate cancer, she said, you kind of have it coming from both angles.
Yeah.
So even if we had sons, I would have them tested genetically as well, right?
Smart.
And so just awareness, that's all it really is. It's not going to fix it, but if that gives you peace to know that you do or don't have a genetic marker for it, then I would say follow that, because I think knowledge is power, right?
It is. And just, I do want to restate again, you didn't cause your cancer, and so many of us feel that way. And
yeah, I talked to my doctor about it. I'm like, what could I have done different? He said, we just don't know enough to be able to answer that question.
No. So,
He said, because if we knew, we would have fixed it by now.
exactly, right.
So if they had a direct link to, oh, I ate Cheetos, and Cheetos cause cancer.
I do like Cheetos.
Oh my gosh.
But they don't.
But they don't. Yeah, I mean, if it were that easy, we would have cut it out a long time ago, whatever
Yeah.
it is, right?
Right.
So anyway, I'm so glad you brought that because that's good information to have. I love it.
Thank you.
Love it, love it, love it. Well, thanks. Well, subscribe to our channel. We want to do more and more topical information, and if you guys have suggestions or you have questions about topics that you haven't heard us cover yet, email us at info@project31.com. We'll be happy to pull something together and
Yes.
answer those questions. That's what we're here for, and we'd love to hear from you. So subscribe to our channel, give us a thumbs up, comment if you have a comment in the descriptions, and we will see you next time.
Sounds good.
Thanks.
Thank you.